Welcome back to the channel. My name's Ed, a junior doctor in the UK, and I thought I'd give you a bit of an update what's been happening in the emergency department in this pandemic in the last couple of weeks. Now, it's been very busy, but not with COVID cases. We pretty much haven't seen anyone in the last couple of weeks, and that means our red zone, our area that was designated for people with COVID-19, has now disappeared. So we still have an amber zone and everyone still wears universal PPE, but we're just not seeing the numbers that we've seen, and obviously that's reflected across the number of cases and the number of hospital admissions that we're seeing. Even so, we've had a huge influx of people come in, particularly those first few days when lockdown was eased, and you may think it was people going out and getting drunk and injuring themselves or being intoxicated, but it really wasn't. It was sort of like when the shops opened up, everyone thought they're quite happy going into A&E. Still, what we have seen is a new presentation, a significant number of people presenting with suspicion of cerebral venous sinus thrombosis. So typically these are people that have had a headache within the last month of having a vaccine and either presented via a GP or just come straight to A&E because of increased awareness and media coverage of these complications. Just for some context here, we're talking about the complication of very rare blood clots associated with low platelets, that there's increasing evidence to link them to the viral vector vaccines. That is the AstraZeneca vaccine, widely distributed in UK and Europe, and the Johnson & Johnson vaccine that's more widely distributed in the US. The complication being that it can put your body into this prothrombotic state, so more likely for your blood to clot, and you get these potentially fatal blood clots in very strange parts of the body, worst one being in the veins that drain your brain, the so-called cerebral venous sinus thrombosis. I've said a couple of times that it's rare, and we don't actually know how rare it is, and I don't want to get anything wrong talking about this, so I'm just going to take a snippet from the government website. So we're just talking about the AstraZeneca vaccine here. It says by the 31st of March, 20.2 million doses of the COVID-19 vaccine AstraZeneca had been given in the UK, meaning the overall risk of these blood clots is approximately 4 people in a million who receive the vaccine. But these complications are potentially fatal as well, as we said. So sadly, 19 people have died out of the 79 cases, 13 females and 6 males. Worth noting as well, it's more likely to affect people who are younger, and most of the people we have vaccinated at the moment are in the older populations. And don't forget, young people as well are less likely to benefit from the vaccine. By that I mean we're less likely to get the complications, so risk of dying or serious illness from COVID-19 as well. And that has led to some advice from the government to use in caution in the under 30s. Again, I'll read this out so I don't get it wrong. The Medicines and Healthcare Products Regulatory Agency and the Joint Committee on Vaccinations and Immunisations continue to monitor the benefits and safety of the AZ vaccine in younger people. You should carefully consider the risk to both you and your family and friends of COVID-19 before making a decision. Currently, the JCVI has advised that it is preferable for people under 30 to have a vaccine other than the AstraZeneca one. If you choose to have another COVID-19 vaccine, you may have to wait to be protected. You may wish to go ahead with the AstraZeneca vaccination after you have considered all the risks and benefits for you. I'm certainly not the person to evaluate the balance of this complex story. I'm not a public health doctor. I'm not a haematologist, so an expert on blood diseases. I'm just a junior doctor in the emergency department. So how is what's going on impacting what we're seeing? So let's talk about this disease, this reaction first of all, and it's pretty new. And it has a new name, so the vaccine-induced immune thrombotic and thrombocytopenia, which is typically very verbose in the medical world, but let's break this down. So vaccine-induced, that's really obvious, right? It comes from the vaccine, and typically we'd see symptoms around sort of 5 to 28 days after the vaccination. Immune, now this means there's some kind of immune element, in this context an autoimmune element, so your body's actually developing something that ends up attacking you. Thrombotic means we get a blood clot somewhere, but it's slightly more specific than that. So a blood clot actually means when blood hardens outside of a blood vessel. So that's a good thing, right? So blood clotting is always a good thing. It actually stops you bleeding to death. But when this happens abnormally within a blood vessel, so ends up blocking the blood vessel, we call this a thrombus. So a blood clot and a thrombus are the same thing going on, but a thrombus is happening kind of where you don't want it within a blood vessel, and a blood clot is happening when you do want it in a sort of natural way to stop you bleeding. But in reality, we kind of use the two terms interchangeably. Thrombocytopenia, so your thrombocytes are your platelets. So these are tiny fragments of cells that are in the bloodstream and they form part of the blood clot. So they clump together and make this kind of plug to stop you bleeding. Openia means low platelets, so thrombocytopenia, low platelets. And normally when people have low platelets, because platelets actually form clots, they're at risk of bleeding. But in this disease, we get thrombocytopenia, so low platelets, but we get increased risk of clotting. So kind of what's going on there? To answer that, let's tie it all together. So it's vaccine induced. So something in the vaccine or something that the vaccine's producing appears to be binding to platelet factor 4. Now this is a chemical that's on the surface of the platelets. And when this happens, so when this complex is produced on the surface of the platelets, the body no longer recognizes it as part of your body and produces antibodies to attack it. And once these antibodies are attached to this platelet factor 4 complex on the surface of the platelet, it activates the platelet, so makes the platelets do its job of clumping together, thinking there's a clot that needs to be plugged up, but it's actually just creating a thrombus. And this is why we're getting thrombus in bizarre places, because it's a systemic thing. It's happening all over the body, so you'll get it wherever, you know, platelets happen to clump together. And this also explains why we get reduced platelets. The platelets are being activated and coming together, clumping together, so they're in specific parts of the body where the thrombus is, and you get less in the circulating bloodstream. So when you actually take a blood test, you get less in your blood sample. Although, as I said earlier, this new illness, the vaccine-induced immune thrombotic thrombocytopenia, is a new illness, it's extremely similar to another also rare illness that we call HIT type 2, so heparin-induced thrombocytopenia. The only thing that appears to be different is instead of the vaccine kicking off this process, it's actually kicked off by a drug called heparin. And because of the similarities, some of the specific investigations that we'd use to diagnose HIT, we can actually use to diagnose this new illness too. So taking all this theory into the emergency department setting, we can actually use a very simple blood test to reassure people that their headache isn't a result of this vaccine-induced thrombocytopenia by just looking at the number of platelets in the blood. However, if they are low, and platelets can be low for a variety of reasons, we'd then have to look at more specific tests, you know, other blood tests, and maybe even some imaging of the head too. So in my hospital, we have an algorithm to assess patients based on the history and these initial blood tests, and everyone I've seen we've able to discharge home safely and rule out this particularly nasty but very rare complication. And really, just to conclude this, we see blood clots in the emergency department pretty much every day. So DVTs and PEs we see all the time. So there's lots of different causes of blood clots, but this particular reaction to the vaccine is a lot rarer. I haven't personally seen it, and given the numbers, I probably won't ever see it. So my hospital serves around 400,000 people, and given the numbers, we may have a couple of people come through with this issue, but the odds on me specifically seeing that patient, very rare. And given the fact that it can be life-threatening, it's really important, no matter how rare it is, that we're aware of it and we can rule it out. It's really important as well as emergency doctors that we also don't just think about that. Anyone coming in with symptoms of headache and other things, we do need to find other reasons for it. So there you go. I thought this may be of interest to some of you, because you've probably heard a lot about the blood clots and the risk going on, and I thought you might want to know how it's impacting what we do in the emergency department, and what to expect if you kind of have these symptoms. If you come into the emergency department, what type of investigations we're doing and why we're doing it. These are difficult things to talk about, right? And sometimes we're hiding behind medical language and scientific language. What we are talking about here is that some people have died as a result of a vaccine. And in medicine, all treatments have risks, but you have to weigh them up in terms of what the benefit they are providing. And the continuation of the easing of restrictions, the reduction in number of cases, the reduction of people dying from COVID-19, a vaccination is the key part, the key strategy to resolve this. And so we have to look at that in the context. And it's right that we're doing what we're doing. The physicians on the ground, when they see complications that they think they might be as a result of vaccination, highlighting that, and subsequently the public health authorities highlighting to physicians what to look out for. So we should have faith in the system that's working. Other parts of the world, you know, our thoughts are really with them and the struggles they are in the middle of this pandemic. In the meantime, in the UK, you know, we've had our fair share of lockdowns, and now it's time really to enjoy things, but to continue to follow the advice and just enjoy the things we couldn't do like a month ago in terms of meeting people in a responsible way, and really businesses getting up and running and people getting a sense of normality. And you know, by continuing to stick to the rules are only going to get lifted. So on that note, I hope you're all well, and I'll see you soon. And I thought I'd treat you to what I've been looking out to as I record this.